Welcome to our InSync roundtables. As always, our little housekeeping, mute your mic when necessary, but of course, at the end, we like everyone to come off of mute and talk about what's going on. Listen deeply, really hear what people have to say. I once lectured my daughter that I didn't feel like she was listening. She was just waiting for her turn to talk again, and that's not what we like to do in a support group. And of course, yes, and let's be supportive and like what could we do to build on top of things and take them back to our groups. Move with intention and always be patient with technology, because while it's great when it works, it doesn't always work. Since we have a holiday coming up, fireworks, love them or hate them. You want to put your answer in the chat. I used to like them, and now that I have a dog, she really hates them, and it's kind of torture for her. So I don't like them as much as a result. Ben loves them. Calissa, no thanks, because she's polite. Kelly said, I like them, but her dog Daisy isn't so sure. Karen says, Lauren loves them. Dave hates them. Oh, Katie says she loves them and her dog is fine. No, we have like a thunder coat for our dog. Nasreen says he enjoys looking at them. So yes, I do enjoy when they're maybe a regular one as opposed to the kind that people are launching in my backyard that could potentially hurt my property. Karen says, love them except when they're set off illegally in our neighborhood. Exactly. It's a love-hate relationship. See, we all have strong feelings about fireworks. Although Greg, I say that, Greg says he doesn't care either way because he's just chill like that. So, well, thanks everyone for sharing. Speaking of technology not working, there we go. So today we're going to be talking about resources, and then we will break into our small groups. So the real question, again, I'm an 80s kid, who are you going to call when somebody in your support group kind of gives you, this is what's going on? So one of the things that can make people uncomfortable is when somebody is in the support group and they're making it very clear that they're having financial issues. Because you're sort of like in your head, am I supposed to offer money or something? What do we do? So let's talk about some of the different ways that you can get assistance with financial things. So we're going to start with medications. Please know we're going to send all this to you. We also are going to send a listing of every state with assistive devices and such, so that if people in the support group need that or you need that, you have that available to you by state. So on our PMD Alliance website, we actually do have under resources, it'll ask for, for medications. So there's things like GoodRx, there's Needy Meds, there's RX Assist, RX Hope, RX Outreach, the Healthwell Foundation. One thing you also want to do, if you're not looking at these, sometimes you can go directly to the drug company. So who manufactures this drug? And again, this doesn't have to be specific for Parkinson's. This can be any drug, and just say like, who makes XYZ? And then go to their website and see if they have a Bridges to Access program, a patient assistance program. Usually it's just a one-page thing. You can print it out and take it to your doctor. So that's for the brand name drugs. Most of this other stuff is for the generics that can still be very costly. And I also encourage people, especially if it's brand name, to ask their doctor for samples. That's really important. If you see your doctor 4 times a year and you can get 2 weeks of samples, that's 8 weeks. That's 2 months of samples that you can then have, that you don't have to spend the money on. There's no judgment or anything. It's just, and the truth of the matter is, if they don't give them away, it gets thrown out. Like, honestly, having worked in a doctor's office, the pharmaceutical reps will come in and they will dispose of the medication. And it's just a waste when you think about it. I can also remember when my kids were little, at the pediatrician, and it never occurred to me that they would have formula. And the doctor suggested a different kind of formula for my son. And she says, oh, here, come with me. And we go into this room And I've never wanted to rob a doctor's office so badly in my life because there was probably over $100,000 worth of formula in that room. And I just like, can I please take more? Like, his formula is expensive. And so, always you want to ask these questions. Other things, food stamps. Something I hear a lot is someone's like, well, I don't get that much. But here's the thing, when you're really strapped financially, $30 or $40 a month is not bad. Okay, that comes out to about $360 to $400 a year that you can save by getting food stamps. So, I understand, especially if you're one person, yeah, you're not going to get $400 worth of food stamps a month, but it's still money saved. Medicaid long-term care. That is something, again, it's a federal program, but it is state by state as to what gets offered. But long-term care is a good way to get some things paid for, whether you can potentially get help in your house. You can also get certain supplies. Like, I know when I was a Medicaid long-term case manager, you could potentially get Insure or Boost, which again, that's expensive. We just needed something from the doctor and we could order that. Incontinence supplies. Again, those things add up when you need, so it doesn't just have to be for Parkinson. Sometimes it's just getting older. These things add up. That's a good way to get them paid for. WIC, Women in Care. I forgot what that stands for. Again, for young onset. It's a supplemental food program, women, infant, and child. It's just something good. You get coupons and stuff for things like diapers, for things like food. It's really a good program. So again, these are just things to kind of have in your head. You don't have to know everything, but just know these things are out there. Assurance Wireless, they will provide free phones. Again, that's a huge savings if you don't have to pay $60 or whatnot a month for a phone. And you can just Google Assurance Wireless. Again, this is not difficult to obtain. You just fill out a form and you get approved. I've helped a lot of people do this. LIHEAP, Low Income Home Assistance Program. This is specifically to pay an electric bill. And again, I understand that, a lot of these things I'm not being able to, supplement someone's income per se, but these are just things that monthly can save some money that as they add up, it will help. And so, for example, if you think if 1 month a year, somebody else pays your electric bill, that's really nice. That frees up maybe $100, $150, depending on where you live. That's kind of cool. The Area Agency on Aging, again, what services do they offer that could maybe be of assistance? And of course, local food pantries. If people are really hungry, I mean, it's a big deal. We want to make sure people have their basic needs being met. And again, like area agencies on aging, they can also sometimes maybe help with rent and things like that. So you kind of want to figure out, like, what does your local area agency on aging do? And again, you don't have to know all this stuff, but just kind of know that this is a resource you could send someone to if needed. And these are big. You do not need to be Catholic. You do not need to be Jewish to use them. Catholic Charities, Metropolitan Ministries, and Jewish Family Services. Again, different areas offer different things. I do know, though, Metropolitan Ministries near me, they also do offer some home assistance as far as with rent or whatnot. Jewish Family Services tends to offer more case management, transportation. So you really have to do some research. But again, these are all just meant to kind of offset, because it gets uncomfortable if somebody's in a support group and you kind of feel like they're asking for money, that it's sort of like, here's what you can do to help yourself, versus kind of saying, hey, could everybody cough up some cash for me? Because that does become awkward, and I know it happens. Also veterans only, but aid and attendance does pay for home care. So that's something else you'd want to look in at your local VA and see what they can do to help. It happens to be a great program. It's not as touted as it should be, but again, veterans only, but it's a really great program. As far as emotional support, if people are looking for counseling or care management, there's always the National Association for Social Workers, and I put the link there. And again, you'll get this. There's also case management, a certified case manager. Personally, I am like a CCM, and so this would be how you could go find someone. Sometimes, again, people will say, well, I have a case manager through my insurance company. And yes, but that person is there to kind of make sure you're doing things to keep you healthy so that hopefully the insurance company saves money. They're not looking out for you holistically. So you just kind of want to be aware that this is a good way to maybe have somebody who's looking out for you a little bit more holistically. The Suicide Risk National Suicide and Crisis Lifeline is 988. Also, most areas have a crisis center, like in Tampa, it's the Crisis Center of Tampa Bay. So, again, if you just kind of want to know, you don't have to, 988 is easy to remember. You don't have to memorize the number to your local crisis center, but just know that you probably have one. And if you just Googled it and maybe just, where is it? Where, just so it's a little bit more in my mind. Someone wants therapy. If you don't know somebody offhand, really I recommend LSVT Global. There's board certified physical therapists. Again, these are all things you kind of just want to be familiar with, because for therapists, you don't really just want to use the yellow pages to date myself, the yellow pages as opposed to Google. The hope would be somebody would say, hey, I use such and such, and he or she was fantastic. But if nobody has really used this, then these are good places to start. And so in our breakout rooms today, I just really want to talk about what are some great resources you have either utilized or recommended for other people. What are some things that you really just kind of swear by and you just really are happy to use? So Kelly's going to put you into breakout rooms. You don't need to do anything, and we'll see you back in about 50 minutes. So around 5 after the hour, so we can share. Welcome back, everyone. So now let's go over what everybody talked about. So we're gonna start with room 2 for once. I'm gonna mix it up. We had Dave Orlowski, we had Devin, we had Karen, we had Lauren, and we had Randy. Who wants to come off mute and share with us what you guys talked about?
You would have to take me first, wouldn't you?
I'm mixing it up.
All right. So we talked about a lot of different avenues to give our people options. The National Association for Case Managers, they help with finding, I believe, finding other getting help for your care. Of course, the crisis hotline. Um, there's assistance fund for Medicare. They help with your drug costs, and you have to apply for that yearly if you're on Medicare. Um, Dave Dave said he saves a lot of money, so that's a very good idea. I'm going to look into that myself.
I was just going to mention real quick, it's not necessarily just for Medicare.
Oh, really?
Yeah, you don't have to be on Medicare for that. It's
So
not
you
just
can get
Medicare.
drugs.
Yeah, if you apply for it,
Oh, okay.
it's
Cool.
not just Medicare.
They have a site with the lowest prices. Medicare does. They that they give you all of the drugstores and the lowest prices of the prices of the medicine, so you can find the cheapest one that you need. Um, Katie does movement disorders for 3 support groups. She usually does 15 minutes in front of the meeting for questions or problems, and then she'll have a speaker. I do 2 groups, both on Zoom and women only, because they tend to talk better without the men. Amazon, they have, um, if you do Amazon without your insurance, they're cheaper than going with your insurance. Someone said that. Um, People had a list of support groups, and I've asked for that list so I can give it to my people too. You can get free national park pass if you are disabled. All you have to do is have a doctor sign that you're disabled, and you can get a national park pass. Um, PDOverme.org. They send out 2 notices a month, I believe is what she said. And a lot of interesting and informative stuff in that. MyParkinsonsteam.com can put you with people in your area that have PD, match you up with people, especially if you're newly diagnosed and need help. High Cap, Medicare Help, SHIP, Supplemental Health Insurance Plan. That's also through, I believe that's through Medicare also. YOPNnetwork.org for young onset people. So we had a lot of information on our group.
That's wonderful. You guys really talked about a lot and covered a lot of resources.
Mm-hmm. Yep.
Anyone have anything to add from group 2? Okay. Thanks for sharing. And then group 1, we've got BJ, we've got Greg, John, Judy, Karen, Naomi, Nasreen, and Bernard. Who'd like to come off mute? Okay, I know this is not a shy group. Who's coming off mute?
I can go. I took notes if you guys want me to.
Sure.
All right. So we had a lot of good discussion. Oh, before I go into it, I want to ask, are you going to be sharing the compiled notes or something with everyone, or?
We're going to be sharing the slides themselves. We can add, like I see Lauren just put the assistance fund, but because you can hear the tape of this again,
Okay.
you can also write down everything.
Okay, great. So our group had a lot of good things to share from all the different areas. There was some talk about some of the resources in your area. So you might have social services or retired or aging services. That is a place to go to that will help find other sources or no other resources that they could refer someone to. And also I was sharing with my group that I have one of my medications is $1,800 a month. And I looked it up, and it's the assistance fund that is helping me, because otherwise I wouldn't be able to take that one. Mm-hmm. There are things like the utility companies. They might have something for a rate reduction, or if you're in an area that gets hit by severe weather or fire, things that take out your energy. There's the resources in areas that help to give you a rate reduction, or maybe even if your power goes out, there's resources that can help to maybe get a backup generator. Some of the areas have places like Meals on Wheels where they deliver food to you, or there was one program that was talked about that was different that I've heard of. It's a food program, but you get to go get a bag and you go shopping instead of getting a bag that they give you that might have things that you don't need, or it's too much of this and not everything that you need. you get a bag and you fill it, but you go in and get the things that you need. There's AARP. That gives a lot of discounts on all kinds of programs, restaurants, travel. There is also places that will help with food and clothing that people donate to. There's different resources that help out with medical supplies. So like if someone needs a walker or maybe a chair for the shower, different things like that, that will help people. Some of the resources and some of the areas will help with medical costs, or there's other ones about pharmaceuticals, and there's something called the Cost Plus program. We went into a discussion that went really into the medical side. So there's a lot that we learned about just when you go into the hospital, or whether it's planned or unplanned. So like when you know it's planned, we learned about different medications that, you know, each of us is different, and that you have to be an advocate for yourself. And that there's formularies in different hospitals, so you need to make sure the drugs that you're taking are on their formulary. But even with that, you have to make sure that there's differences sometimes in the same drug. So you might have, like Cinemat could be from a different manufacturer, or they might feel like you could take this one, but it might be a little too much or too little. So you have to be your own advocate. There's something that you could do on your phone that's called SOS. And another one, and there's ICE. So ICE stands for in case of emergency. And with that, you could do things like you could share your medications, your health history, your contacts. So if you get in an accident and you're passed out and you're not conscious, you could have that on your phone. So those were some really good advices from people on our group. I'm trying to look. At USC, let's see. One of the things is like with the patients is getting their approval to work with someone or to reach out to social services in their need. And then there was something called, I'm not trying to promote being bad, but there's something that is a cute little bear that was shared. And I was saying it's like a snuggle bear, but then I changed the name to Smuggle Bear, because the head you could unscrew and then you could put your meds in it. So that was like a little tip to share, because sometimes you don't get what you need on time when you need it. And that's really important for people with Parkinson's.
Here's the bear. He's more than 30 years old. I introduced them to the breakout room, our breakout group. My sister was an anesthesiologist here in Santa Cruz County, and she was always concerned that if she got to the hospital, she wouldn't be able to get her medications on time, or the right medications. I don't know where she got this baby. The tag says emotions, and it's made by Mattel. And the beauty of it is that the head comes off, it has a violence side. So I like Naomi's designation of being the smuggle bear. Eden, I would suggest that a future meeting of this kind be devoted to hospital safety. It is a big issue. I mean, the Parkinson Foundation has been doing a lot in terms of education, but particularly when it's an unanticipated, unplanned hospitalization. Hospitals seem totally unprepared to deal with the issue of getting their patients the right medication at the right time and not giving them contraindicated medications. It's a very important issue that I think needs to be addressed again and again.
I'd like to add, I've been searching for the bear online, and it's mostly available on eBay.
Oh, really?
Yeah, it's not available. It's not a marketable item anymore, so you'd have to.
Oh,
All right.
I haven't found, when I click on the descriptions, I haven't found one yet that says the head comes off. So I'm not sure,
so you better buy it now.
but I'm going to keep searching.
Okay, good. But there are
There-
other ways, but it's an issue of some people have been fortunate enough to be able to take their own medications into the hospital and to get permission to have them given to the patient, but a lot of that involves pre-planning, and John in North Carolina talked about that. If you have the luxury of being able to plan ahead, of communicating with your physician, with the pharmacist at the hospital, with the staff at the hospital, I would suggest that if all of you, like Naomi, have a schedule, I would make a poster size. If you end up in the hospital, you have somebody mount it right above your head of your bed, so
Oh,
people
yeah.
can see that it doesn't get lost in a folder someplace.
Yeah, Karen's referring to, I have a little piece of paper that I have down, Naomi has Parkinson's, and then in an emergency, contact this person, the phone number. But it's got all my medications I take, the time of day I take it, and how much I take. So I made that a little piece of paper. It's in my wallet. It's in my my husband's wallet. So, and then that's also like on someone's phone.
If
I
I can
believe
break in,
most all inpatient rooms will have a whiteboard. And on the whiteboard, if it's not on there, it said this person has Parkinson's and this is a dosage and this is the time given. And a lot of times it's the care partner that writes it on there and makes sure it stays on there. So
if I can break in, my daughter is a nurse on a neurological floor in a hospital. And I asked her one time, do Parkinson's patients get their meds on time? And she said, I have 6 patients by myself. Sometimes they cannot get them on time. So I myself have a little bag that the Parkinson's Foundation sent to me, and I have all of my medications in that bag that goes with me. And I'm not going to tell anyone I have them.
That's your smuggle bear, your smuggle
Right.
bag.
Yeah, but I like the bear idea. I might make myself a bear.
Yeah.
the Parkinson's Foundation no longer puts out those bags, but they have a book covering everything that's in that bag, minus, of course, the medication. So it's just a book that you can't take with you, and you know yourself, and make sure that you're saying the right things when you do enter the hospital. So the wear and care kits are no longer available.
And we had Bernard had mentioned that when they've gone in, they have a bag of the medication bottles that are empty, but to show them.
Do you have a question, BJ?
I was just going to say about the bag for the Parkinson's Foundation hospital kit. The reason why they got rid of it was all the forms inside the print was too small to be usable for most people, and so we made a big book. It's and it has tear out sheets. So the new hospital safety guide still works in the same manner. It just doesn't come into a bag, and it has tear out sheets for the nurses and for your medication list. And also they have the nurse bears on Etsy. Don't forget Etsy.
Oh. I'm gonna have to look that up because I Googled it and I couldn't find anything. So now I will try
Nurse bear.
Nurse bear.
What's it called?
The one I found was called a nurse bear.
A nurse bear.
Yeah.
All right.
And I Googled nurse bear medicine and it came up.
And the head comes off?
'Cause I'm seeing like gifts for people.
No.
Yeah, I'm seeing like gifts, but I'm like, okay, I wanna
Anyway, this is the
see if
new
it can-
guide
Oh.
and it has all the forms you can tear out and fill out. But it teaches you how to be your own best advocate in the hospital.
I'll order
So
some of those. I'm gonna order some of those.
It's a good book.
like put it in
and
the
it's
chat.
not very thick. It's not huge, but it tells you everything you need to know.
Yeah.
Kelly, put that in the
Hospital
chat,
safety guide.
and I'll also send it out in a follow-up email so everybody has it.
All right, I'll do it.
Any final thoughts? Anything that didn't get mentioned that someone said, you know, this really helped me a lot? Oh, there we go.
Oh, one of the things that I mentioned is that at our April meeting, Naomi and Bernard and I, who are all here, sort of the Monterey Bay area, talked to each other about getting together, and that the started. I'm calling it the Monterey Bay Parkinson's Consortium. What will come of that, I don't know, but it's because of our meeting at the site that we're beginning to communicate so that we can in the future be helpful to each other. So I appreciate your getting us together.
And just a quick plug, we're doing it again in Baton Rouge called Mission for Movement. We're bringing together all the Parkinson's leaders in our community. So everyone's on the same page and we don't waste resources.
Mm-hmm.
So themissionformovement.org.
Yeah, that was a good point because sometimes we're working in silos, we're duplicating things or you know, just to be able to know each other, get to know each other and share or learn from each other too.
Important to be collaborative because, like you said, nobody needs to reinvent the wheel when someone else is already doing it.
Yeah.
Well, I thank everybody for coming, especially I know it's a holiday week. So thanks for being here. We're going to send out the things that were in the chat. Of course, the you know, you can listen again and get what you missed maybe. But I thank everybody and I hope everybody has a wonderful and safe holiday. Bye, everyone.
Thank you.
Thank you.